I'm Gibson, Dan Judge, coming to you live from ACC 2025, and we're talking about the role of tafamidis when you cross over to that agent in a trial of another molecule. Dan, talk to us about the outcomes.
Well, thanks. Yeah, we're very excited. I think in the ATTRibute-CM clinical trial, the last trial I think that we'll ever see with amyloid that has a placebo arm, we said for the first year you could not take any other drug like tafamidis. And then after that, as sites around the world were getting access to it in the US, certainly we had access to it, although many of the participants chose not to take tafamidis. Overall amount of people after 1 year that started tafamidis was 17.5%, 14.9% of the acoramidis arm and 22.8% of the placebo arm started tafamidis. The average was around 17 months into the trial, and the duration of tafamidis exposure was about 11 months. So we asked the question, did that influence the outcome? And we had two different ways of looking at it. One was to say, anybody who was on tafamidis, let's just ignore them. The other was to say, as soon as they start tafamidis, let's ignore any events after that. And in both of those analyses, there was no difference. We used the same primary endpoint, the Finkelstein-Schoenfeld, four-part hierarchical win ratio, essentially, and showed no difference. The p-values were the same. And the conclusion, of course, is that acoramidis was the reason for the success of the trial, and tafamidis didn't have anything to do with it.
Interesting. And talk to us a little bit about the differences in the mechanisms of action.
They're both stabilizers, but they are different. Both of them stabilize the TTR complex, and it's the isolated monomers of TTR that misfold and deposit as amyloid.
Great. But Dan, thanks for joining us. Thanks for sharing. Thanks for all of you listening today, this week from ACC.
Thanks.